to introduce Tammy Jackson. Tammy has been a member of HFMA since 2002. Ms. Jackson has served the National Association as a member of the National Advisory Council and as an elected director on the national board. At the chapter level, she served as the president of the South Texas chapter and as a chair and member of various other committees for the Gulf Coast chapter, First Illinois chapter, and South Texas chapters. She is a recipient of the HFMA's Medal of Honor, as well as the Fulmer Bronze, Reeves Silver, and Muncie Gold Merit Awards. That always gets stuck in my mouth. In June of this year, 2021, Ms. Jackson will be installed as the 2021-2022 National Chair for HFMA's Board of Directors. And with that, I'm going to turn it over to you, Tammy.
Thank you. And Pilar, can you give me a thumbs up? You can hear me okay?
I can, yes.
Perfect. Okay, fantastic. So I just want to say, start by saying thank you. I am super excited to be here. Really appreciate the invitation to visit with you all. Am loving this platform that you all have tested out. And I continue to be very amazed at how the chapters have just innovated over this last year as we continue to deliver high quality education to our members. And so I'm going to share with you today somewhat of an abridged version of the national deck. The National Officer Deck is what we call it, that we have been sharing with chapters around the country all year. And as Pilar just mentioned, you know, our membership year will end here in about 6 weeks or 5 weeks. And so didn't want you to lose out on the opportunity to share, you know, what we have been delivering around the country. So with that, on the next slide here, you'll see that our agenda is just pretty succinct. I want to provide you with an overview for the organizational theme that we had used over 2020, 2021. And to that end, we're going to talk about, you know, basically two different factions, if you will. We're going to talk about current healthcare industry challenges, and then we're going to get into the resources and initiatives that HFMA is working on in order to help you address that. And so let's just go ahead and jump right in. On the next slide, you're going to see, you know, that our mission, your challenge, our mission, and this is, you know, relative to challenges, we've certainly had our fair share of them all year, and that's both personal and professional. And so the good news is that you're not alone. We've got each other. We've got HFMA. HFMA has dedicated its efforts to supporting leaders to overcome these challenges. And, you know, again, both organizationally and professionally. And I think, and I would trust you'd all agree, if ever I was, you know, unsure of how relevant we remain in this industry, I was assured that in fact we are. Over this last year, HFMA as an organization has truly pivoted with the way that we deliver content, the educational platform that we rolled out, and I really think that we took this mission to heart. And so unlike in other years where the chair kind of dictates the theme over the year, when you might recall Mike Allen's the year before was Dare You to Move. Your challenge, our mission was really an organizational theme. And we, like many of you, halted governance for a year. And so Mike served as 2 years of chair. So he's finishing his year here over the next 5 weeks. And so this was a really opportunity for the organization itself to really dig in and deliver on a really strong theme. And so just on the next slide, you know, we're going to take a look at some of the challenges, again, like I stated, facing our industry and what we're doing to support. And then we will start with the ongoing pandemic, which is obviously top of mind for all of you. And so no surprise to anybody, right? The industry closed out 2020 with declining volumes and outpatient revenues due to record levels of COVID-19 hospitalizations, staffing issues, you know, people being fearful to return, all of that runs the gamut, right? So according to a year-end report that was issued by Kaufman Hall, the median hospital operating margin was down 4.9% for 2020 without the federal relief funds, and it was down 1.2% with the federal funding. And so for those individuals, those you know, for anyone that might be those conspiracy theories that were out there that saying that hospitals were just making money, I think we could all assure them, as does this data, affirm that in fact that was not the case. And as hospitalizations soared due to the virus, outpatient volumes overall had declined as patients again became reluctant to seek those services. Our operation room minutes fell 10.5% for 2020. And then emergency rooms, right, saw massive decline with volumes falling 16.2% compared to 2020 compared to 2019. And I think that, you know, TransUnion has done quite a bit of study on this, and those volumes are not returning. And in fact, you know, I think I probably would not be alone by making the argument that it's likely that it won't return. And I think that might not all be bad. While the hospitals are scrambling to figure out, you know, how we replace that revenue, at the same time, we'd all agree that the ED is sometimes, you know, might be used inappropriately, and there are lower cost of care settings that we can be treating our communities. And so maybe that's one end result, is that people have, they're a little bit, they are a little bit more intentional on where they seek care and the reasons therefore. Outpatient revenue fell 6%. And then meanwhile, so you've got all these volumes that are decreasing, you know, revenue that's decreasing. And while that's going on, expenses just surged. So they surged 7% for hospitals in 2020, and we all know that that's a pretty big chunk, and it's hard to fix that quite immediately. The biggest increase was drug costs. That rose 32% in 2020. Second, of course, probably no surprise, was 16.6 with the supply chain. So labor expenses also rose 5.4%. As hospitals have had to pay more for additional staff to fight the virus, compensate for staff burnout, losses due to infections, that runs the gamut. And I think that also I was having a conversation with a CFO, and they are now having to cancel elective surgeries because they can't staff the surgeries. And so I think we continue to see kind of the ramifications of how this thing is going to play out. So on the next slide here, we're going to talk a little bit about just you know, how this is, you know, how this is also now creating some other challenges that we may have to deal with 2021 and into 2022 even. And that is that providers and health plans are increasingly worried that patients undertreated during the pandemic, and they could reemerge sicker and costlier. And for those of us that have attributed, you know, patients where we have finances or reimbursement that is at risk, for all those of us that are with self-insured employers, that's a big concern. So patient volumes, testing, screening, and acute ED patient trends, they were similar across the country. According to data from more than 900 hospitals tracked by Centellus, through September of 2020, compared to the same period in 2019, of 30% for colonoscopies, 16% for mammograms, 12.2% for cardiology visits, 8.6% for endocrinology visits, and 8.4% for oncology visits. And so the screening alone, you all can just, you know, that it's shocking when you have that kind of a decrease. And we all know that the diagnoses that come out of that. So all of that has gone undiagnosed, untreated, when time is of the essence in a lot of these situations. Another consumer survey that was conducted by PricewaterhouseCoopers found that between March 1 and September of 2020, patients with diagnosed chronic conditions reduced or stopped needing stopped maintenance care. So 1/3 of patients overall delayed care, 1/3. 56% of patients with multiple chronic conditions delayed care, 56%. 45% of patients with cancer delayed care. And we all know, again, time is of the essence. And 57% of patients delaying care delayed it by more than half. And so, as you can imagine, providers, health plans are certainly going to be really trying to reconnect with those patients here in short order to make sure they can get them in for care and make sure they can try to control any situation that they're able to. On the next slide, we'll talk a little bit about healthcare forecasting. Another thing that we've really learned as a result of our pandemic experience is that healthcare organizations need a forecasting system that provides a lens for what lies ahead. We can no longer just depend solely on reviewing past claims or historical behavior trends to determine next steps. That becomes particularly relevant at this time. Our last 12 months of data is for naught. And in the meantime, so many other things have happened, right? So not only is the data flawed, but then the economy has done some interesting things that could impact future behavior. And so we need something more dynamic. We need real-time insights to alert us to shifting fronts that could have major impact on our business. And so dynamic strategic planning, advanced analytics, modeling, all of that can help us to better prepare for shifts in the insurance market when we see our payer mix shift unexpectedly or abruptly, the economy, which may in fact influence the insurance market, utilization, consumer behavior, and unfortunately, we need to be prepared should something like this happen again. And so that there's a lot of activity now on forecasting. On the next slide, we're going to talk about telehealth. And so in response to the pandemic and aided by unprecedented Medicare regulatory and commercial payer flexibility, providers rapidly expanded telehealth services. And I think if there was, there's several, there's so many stories around the country on how provider organizations just quickly pivoted to address some of these challenges. But I think telehealth was one of those things that we had struggled with implementing for so many years. And for those of us that have worked in value-based care quite a bit, like I have, we see that as a very viable and meaningful option to deliver low cost care, right? And still have good outcomes. And so it was a struggle to kind of get that off the ground. So it's just been really exciting to see how it has just exploded. But the potential growth in telemedicine could be staggering, assuming that the temporary flexibilities are made permanent, and whether that's through legislative recovery or even private market changes. Analysis suggests that more than 20% of all office, outpatient, and home health spending could be delivered virtually, with impacts differing by sector. And as a result, many in our industry are looking to shift their mindsets to view technology as a fixture in the healthcare landscape and not just something that's kind of nice to have. So on the next slide here, I want to just point out that, relative, your challenge, our mission, right? So those are some of the challenges, and I really peeled out just a handful of them. Some of the challenges specifically related to COVID. HFMA has made it a top priority to provide you with access to the latest information on all of these pandemic-related challenges. And so to help you find what you need quickly, there's a dedicated space on the website. You'll find a variety of information there on, about the virus and its impact on healthcare finance. And then it's right under the little tools there where you see the finger pointing. But it includes, news, podcasts, webinars, other resources that might be helpful to help you navigate this, this emergency. So on the next slide here, I want to just take a few minutes and talk about price transparency. And so, you know, and this goes, of course, beyond the current pandemic-related challenges, but certainly been a challenge. And so as of January 1, hospitals were required to post online in a consumer-friendly format their payer-specific negotiated rates for 300 shoppable services. As an alternative, hospitals could choose to maintain a web-based out-of-pocket price estimation tool for shoppable services. But regardless of which option you chose, you're still required to publish a machine-readable file containing all of your payer-specific negotiated rates for the entire charge master. And so, you know, we do at TransUnion, we do a lot of work in this space. And so I've heard, you know, I hear you. I know this gives a lot of us a great deal of angst. And many of us would challenge whether or not this achieves the end goal. I think transparency, universally, we can all agree it's a good thing and it's a good idea. But we have to take a step back and question, does this get us to a consumer that is more readily informed, better informed, and able to make good decisions? So in a recent study, and I think it just came out I think maybe a month ago even, Health Affairs, they published a study that said they looked at the websites for 100 hospitals, and then from January 21 to February 21, and 65 out of the 100 hospitals they sampled were unambiguously non-compliant. 18% did not post any files or provided links to searchable databases that were not downloadable. That's not compliant. 82% either did not include their payer-specific negotiated rates with the name of the payer and plan clearly associated with the charges, or were in some other way non-compliant. And then 22 hospitals of that whole 100 appeared to be completely compliant. And so, and some of them even exceeded the regulations. As a result, what has also happened is Congress has put together a letter and sent that over to the regulatory agencies and said, hey, hospitals aren't doing this, and we needed them to. This is a clear directive, clear intent to achieve an end goal. And so I assume that many of you might be scrambling to make sure that you're prepared should they come asking questions. And so that's certainly something you're all dealing with. On the next slide, though, leading up to that deadline, I want to call your attention to some of the resources that we have available. Leading up to the deadline, HFMA had offered live and on-demand webinars to help you prepare to meet those requirements, and these are still available to you on the website. In the meantime, I want to remind you about HFMA's report on price transparency in healthcare. And this report was developed by a task force. You know, we love task force at HFMA, but this one included health plans, providers, consumers, employer groups, physicians, and others. And it provides guiding principles and recommendations for improving price transparency in healthcare, right? So that was its initial goal. It's been around a while. So we have been talking about price transparency here at HFMA for a long time. And we did state in there, price estimates should show out-of-pocket costs to care purchasers. It should be combined with quality, safety, and outcomes data. It should help the patient compare the value of the services that's being provided. And finally, I would encourage you to join, there's a price transparency group that is in the community section of our website. And so there you can have good dialogue with your peers around the country and to understand what they're doing, what some of the challenges and barriers were, what some of the feedback they're getting from their communities, all of that. We're going to move to the next slide here. Another current challenge outside of the pandemic is all about medical debt. And I would say both for patients as well as those of us working in healthcare finance, medical debt is an issue. And consumers see headlines like these regularly, And for many, it's even personal, as they too may be struggling to pay some of the medical bills that they're responsible for. In such an environment, especially now that patients are paying, they're bearing a bigger portion of that burden, hospital and health system finance leaders, they want to be confident that they are handling the patient financial portion responsibility of their bills in accordance with best practices. So for that, on the next slide, this is another place where we can help. Last fall, we released an update to our guidance on the resolution of medical accounts. It was developed by what? A task force, and that task force included HFMA members, ACA International, Catholic Health Association, and also Community Catalyst, which is a consumer patient advocacy group. And our previous guidance actually was in pretty good shape, but given kind of the recent media focus on collection actions, we just took an opportunity to update it. And so we did things like, rather than reference materials, we actually put in formal links to those materials. We included a checklist with pause points before going to extraordinary collection action. There's more governing board education and awareness recommendations, clarified that 501R procedures, while that is mandatory for tax-exempt organizations, it's actually, a good idea for all healthcare entities. And then better graphics and illustrations, flow charts, FAQ section, all of that. And so just that's a resource that's out there for you as well. But on the next slide, you'll look at, that before COVID, we actually all had full-time jobs, and they were pretty full, and we were dealing with consumerism, data analytics, digital transformation, rising costs, social determinants. This is a daunting list, and all of those issues still remain. There's still things that we are grappling with, and I want to assure you that going into next year and beyond, that we will continue to work on these fronts as well. So our mission on the next slide here, to lead the financial management of healthcare. And so our goal, our gig, if you will, is to provide you with tools, practical tools, solutions, education, and industry analyses, and guidance to address many of the challenges that you're seeing. And then with our streamlined membership experience and state-of-the-art platform, which we're real proud of, we're well positioned to help with that. So I've already touched on several initiatives related to current challenges. I want to spend the remainder of the time here, and I'm gonna, let's see how I'm doing on time. So I should be maybe another 10 minutes, Pilar, and I hope that's okay. I would provide you with an update on some of the other things we're working on. So I'll try to move through here quickly. So here you see, we regularly conduct research on current trends in management, and you've all in healthcare financial management, and you all seen that over the years. One such report that we published last year offers insight into different perspectives that finance and nursing professionals bring to nurse staffing issues, along with guidance for bridging the gap between those two groups. So this was a really important initiative that we had launched, and given all that we were dealing with, we just really didn't get the word out on this one. But nursing staffing is that perennial place that a CFO might go to in order to figure out when they're trying to move things around in order to make the budget work. And that was creating a lot of angst between those two factions. And so we worked with American Nurses Association, American Organization for Nursing Leadership, to co-author this report with us. And it's a 19-page report. It explores the different sources of stress that nursing and finance leaders encounter in the course of their work. And the thought is really by enhancing the mutual understanding of the respective professional roles and challenges, it'll make it easier for the two groups to work together. And you can download that report. On the next slide here, our annual Thought Leadership Conference. This is originally launched in 2007, by far one of my favorite meetings of the year. It's a forum where the brightest and best minds in our industry come together to discuss current issues. very think tank-like-ish, but they explore all kinds of really interesting topics and then we put out a report on that. 2019, we focused on how the industry might better address the social factors that impact health, and then to develop recommendations on how we can redraw some of the more traditional boundaries and ultimately lower the total cost of care. And then get this, in 2020, we were supposed to get together to talk about transformation post-COVID. And so unfortunately, you know, we had to cancel that because we're still not post-COVID, but we are really hopeful that we can meet again in 2021 in October of this year. And the reports are all on the website, and I encourage you to check those out. On the next slide, we start to talk about the regulatory and accounting resources that are available to you. We publish fact sheets that summarize really complex proposed and final rules that are issued by agencies, you know, CMS, IRS, FASB, GASB, other legislative entities. But this year alone, or I'm sorry, rather 2020, we published 21 fact sheets and comment letters specifically related to COVID-19. So I would encourage you to leverage that. It's an incredible resource. We have a whole team in Washington that does nothing but kind of, peel back the onion on all of these things and really break it down for us in a meaningful way. All of these are on, if you go to industry initiatives section, there's a subgroup there called regulatory and accounting resources, and that's where you can find it. The consumerism maturity model that's on the next slide here, this is the newest tool in our patient financial communications arsenal. Another thing we launched last year, didn't get time to kind of really get it out there. This is really in response to just the evolution of consumerism. And I think healthcare providers were doing two things. They didn't know, like, is what I'm doing working, and how do I compare to my peers? And so we convened a task force of revenue cycle and finance and consumerism experts. And they reviewed the current state of consumerism in healthcare. They developed and recommended a measurement structure that provides you with the ability to demonstrate your progress towards achieving a more consumer-centric revenue cycle operation, and really to assess your consumerism maturity. And so, I encourage you to take a look at that too. You can download that off of the website as well. And then on the next slide here, we really just talk about HFMA.org and some of the other resources that we have. And I wanted to make sure that I impressed upon you that you can customize the content you see on HFMA.org, as well as what gets delivered to you. So by clicking on the For You tab at the top center of the screen, you can edit your settings and then tell it more about you, what you're interested in, career path, all of that. We produce content daily, and that content gets delivered through a number of resources, and by doing so, you're going to help the system curate what's important for you and be able to push that to you. HFM is a magazine that we have completely revamped, and I hope that you have enjoyed that. It's been probably about at least a year now, probably even a little bit more than that, where true cover stories with a focus on healthcare finance people, features and current events. I know I always look forward to the magazine now to see like who's on there, because many times I know those people, and so it's really cool to be able to see that and connect with the magazine in a very different way. And it's easier to read and navigate. It's got a lot of chapter content too in there now, which is really cool. You've got our podcast, our Voices in Healthcare Finance. That's been a really important vehicle for getting content out there. Our HFMA Daily reaches 40,000 subscribers a day. And that's the one I would encourage you, click on the articles that, even if you don't get time to read them, open it up so you're telling the system what's interesting to you. Our weekly e-news lineup was revamped, so we are very conscientious about how much we send to you. So there's different newsletters each Tuesday. So one might be leadership, one might be revenue cycle insights, financial sustainability, etc. And we've recently launched a quarterly news email that will be sent to everybody. It's the hot list, and it is an analytics-based roundup of the most popular articles, webinars, and community groups. So even if you miss a whole lot, make sure you pay attention to the hot list, because hopefully your peers have honed it down to what might be of greatest interest. And then finally, the last resource I would call out is HFM is now digital. And so you can put that on your phone. Once we get back on the road here, we'll be able to take the magazine wherever we go if we're traveling. And that will make it easier to digest for us all. And so, and I think it comes out on the first Monday of each month. On the next slide, highlight for you, peer review program is always an important resource. It allows you to get a short list, if you will, of products and services and ROI calculators that have earned the designation of peer reviewed by HFMA. And that means that they've been evaluated by users like you for quality, technical support, customer service value. And it really is to aid you in making decisions. And maybe save you some time and skipping a couple of steps. On the next slide, we'll talk a little bit about HFMA's educational opportunities and career development programs. So this has always been an incredible piece of our membership benefit. And that includes, live events, webinars, learning paths, certifications, and then the job bank. All of these can be accessed through the website. And then I would say on the next slide, our biggest event of the year, I'll share with you that while again, we paused governance, and I was supposed to be installed in San Antonio last year, which would have been the first time that a chair was installed in their home territory, because I'm a member of the South Texas chapter. And then I was supposed to roll off in Boston this year, which was equally special because I'm originally from Massachusetts. So it was just two bookends that were really, really, serendipitous and very cool. But in any event, we all know how that all happened, and I am super excited that we will be having an annual conference in person in November in Minneapolis. And I think by then, we will be vaccinated and very comfortable getting out there and getting together. And I do hope that you can join us. It is our 75th year anniversary. And so we've got a lot of special things planned. And so I hope that you mark your calendars for that and you can join us. And that, of course, is our biggest learning opportunity as well. On the next slide, and I mentioned it early on, we rolled out a new educational platform, an e-learning platform, and it replaces the old one. And this really just has, easier ways to navigate the system, personalized suggestions and learning paths, enhanced interaction, just an overall improved learning experience. And so I hope that you've taken advantage of that. On the next slide, we talk about, certifications, and this is part of your certifications as part of your overall membership now. And so you can reach your goals, by sharing your industry knowledge. And Jessica, I'm sorry, you can move to the next slide there. I might have slipped that in without, and you didn't catch it. But really, it's a way to demonstrate your industry knowledge along with, of course, but just building your own proficiency. And I also think, when there's other things you want to be doing, it's a good way to kind of build that knowledge while you're currently sitting in the chair. So I am going to try to wrap up here. I think on the next slide, I can share with you that our membership is growing. We have 64,000 members now, and so we keep breaking records. For those of you that might not be members, we do trial memberships, so I encourage you to get online and try that out. And I think in the last thing I'll share, and I am going through these quickly and I apologize, But the last thing I would share is just the communities on the next slide there. And that really is just, it is a way for you to connect with each other and your peers across the country to solve different problems and just to engage. And so hopefully you're familiar with that as a resource, but it is probably one of the most important ones I think we have on hfma.org. So I encourage you to get engaged there. And with that, I think that we will just get to the last slide there. And I appreciate your time. Appreciate you letting me just go through this so quickly. And I will turn it back to you, Pilar.
Thank you, Tammy. Thank you for all this great information. I know it is very much appreciated, and look forward to your upcoming year